This is the Emergency Medical Minute, sponsored by Health One. Okay, so I'll give you just a brief medical minute on drug addiction, but not to opioids, so yay! Okay, so there's a drug that I was just amazed at that there's this really bad withdrawal from that we prescribe all the time, and it's something that should be on our list. And we give it a lot for actually indigestion. So what type of drug do you think it is? It's a proton pump inhibitor, right? So things like Prilosec, omeprazole, Nexium. Did you guys know that actually has a pretty bad withdrawal? So if you take it for over a month, people actually have this tremendous rebound dyspepsia. So it's like you turn off all the proton pumps in someone's stomach for like a month, and then when you stop taking it, you actually produce an extremely large amount of acid. And because of that, there's a lot of people who have problems getting off of that drug, and oftentimes you have to undergo a really long taper for it. So that's kind of on top of the other kind of literature that says that these drugs actually have really bad long-term risks, and are some people aware of the risks that are associated with PPIs? No. So what's one of the principal rules of acid in your stomach besides digestion? Breaking down bad stuff, but also breaking down bad critters, right? So if you actually stop that and you don't produce as much acid, it actually affects your immune system. So people have a lot more GI infections, so it more than doubles your risk of getting C. diff. It triples your risk of getting E. coli or salmonella related things, right? This is part of the reason why I think that in a lot of countries where you don't have as good hygiene, spicy food is really, really popular. In a way, it's because it helps you kill a bunch of bad bacteria, so you don't have as much diarrhea, right? So it's a really interesting kind of phenomenon there. But anyway, so you have an increased risk of infection, not only of GI infections, but of pneumonias, right? Because you also think that there's bacteria that travel back and forth constantly while you sleep between your gut and your lungs and that whole area. So people have increased incidence of pneumonias with those. The other thing that people get with PPIs long term is they get increased fractures. So PPIs and not having as much acid in your stomach actually affects your ability to absorb some of the common nutrients. So one is it increases your risk of fracture, and then two, people sometimes get really profound hypomagnesiemias with them. So your magnesium levels sometimes get really low with a long-term use of PPI. In general, the thing that I kind of take from this is, one, it's not a benign drug, right? And putting someone on the little purple pill or Nexium or all these other things and telling them, oh, just take it for a month, actually has pretty significant side effects. The really largest duration you should try to get people on these, if, for example, they have suspicion of an ulcer or something else, is really 1 to 2 weeks. And then you should tell them to either transition to over-the-counter antacids or put them on an H2 blocker, which isn't as powerful like Pepcid that we use all the time. So just something that we should all be aware of. Okay, your team. We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.